Good afternoon. Thank you for joining us. The BC government says its decriminalization pilot did not deliver the results it had hoped for, and so the project will come to an end January 31st. How do you feel about the end of decriminalization in BC? What should happen now? How can the province help people struggling with addiction? We'll talk to former Chief Coroner Lisa Lapointe, SFU health researcher Julian Summers, and Victoria Chief of Police Fiona Wilson later this hour as well. And we are taking your calls all hour today on BC Today. I'm Michelle Elliott. Welcome to the show. You can call us now. How do you feel about the end of decriminalization in BC? What should happen now? And how can the province help people struggling with addiction? Our number is 604-669-3733. That's 604-669-3733. You can also dial 1-800-825-5950. You can just hit pound 690 if you like, or email bctoday@cbc.ca. We are watching your comments on our TikTok as well. In 2023, the province began the 3-year pilot project, which allowed people to possess small amounts of some illicit drugs. It was part of a push to try to save more lives amid the toxic drug crisis. But critics called it a failure and said it led to public disorder. BC Health Minister Josie Osborne did announce yesterday that the pilot did not meet the province's goals.
In 2023, we launched a pilot program to decriminalize people who use drugs. Our intention was clear: to make it easier for people who are struggling with addiction to come forward and seek help. From the beginning, this pilot was designed as a time-limited trial with ongoing monitoring built in so we could understand what was working, what wasn't, and where changes were needed. However, the pilot hasn't delivered the results that we hoped for. And after very careful consideration, we are not asking the federal government to renew the exemption.
Joining me now is Lisa Lapointe, who served as BC's Chief Coroner for 13 years before retiring in 2024. She's been a vocal advocate of decriminalization in the face of BC's toxic drug crisis. Good afternoon. Thank you for joining us, Lisa. I don't know if you're on mute or if our connection is. Are you unmuted now?
I was on mute. Thanks, Michelle. Typical.
I know it's
typical novice mistake.
It is the first step. No, it happens to all of us. Thank you very much for being with us. Your reaction to the end of decriminalization?
Well, I was certainly very disappointed. I wasn't surprised. I think the government had been indicating that they intended to go that way, but it is a real disappointment. I listened to the minister yesterday when she announced the news, and I almost felt a little bit sorry for her because as she struggled to explain the inexplicable. So she said that the program didn't meet the government's goals, but when asked several times about what goals, she said it was hard to measure goals. I find that a little bit interesting because of course, there are some goals that they did measure that are in their reports to Health Canada that were very positive. And in fact, if you read, and I have been keeping track of their ongoing reports to Health Canada on the pilot, they've all indications have been very positive. So it is very disappointing.
What are those benchmarks that you're seeing? What Osborne said yesterday was, yes, that it's hard to pinpoint what the cause and effect would be in terms of seeing any improvement. But she said they did not see an increase in self-referrals to care or an increase in use of services. What are the benchmarks that you believe indicate that there was success in this?
Yeah, so I find that statement a little interesting because if I look at the report to Health Canada, in fact, what they said was that core service utilization indicators, that's the language they use, are stable and increasing. And that included visits to overdose prevention sites, supervised consumption sites. We know that possession, arrests for possession and seizures of drugs across the province were down. And not only were they down, they were becoming more equitable. So prior to the decriminalization pilot, in its application to government for the exemption to to Section 56 of the Controlled Drugs and Substances Act. The province said one of the challenges was inequitable policing for drug offenses. Some towns police far heavier than others. And there was a lot of discretion on the part of police. And that was a real concern. And we already know that there are real challenges with inequitable enforcement across a number of offenses across the country. So that, and in addition, deaths decreased substantially. And I acknowledge what the minister said, and I don't falter for that it is hard to attribute any one thing to some of the indicators, but the death rate in our province has decreased significantly. In fact, we're right back to 2019 rates, which are far lower than they have been in the last 7 years. So that's a positive indicator. All of these things to me suggested that nothing got worse in terms of the goals they were trying to achieve, which was to positively impact the health of people who use drugs, steer them towards health services, and encourage people to be forthcoming about their substance use and their need for help and support.
I will say that Minister Osborne did talk about those measures, those data points that you mentioned as well, in terms of offenses being down and seizures being down as well. And that was what she was referring to in terms of, do we know exactly what to attribute that to? And as you say, the numbers of deaths from toxic drugs has gone down. Last year, as of October 31st, the preliminary data was 1,538. And of course, the peak was in 2023 to 2,589. Now, you said nothing got worse. There are the critics of this who would say public safety got worse, right? And in 2024, the BC government did kind of roll back on this already, saying once again, those small amounts of illicit drugs are illegal in those public spaces, transit, hospitals, parks. There was that backlash that this was leading to public safety issues and street disorders. So how much do you think those concerns have been a factor here?
Yeah, I think those concerns have been a significant factor in the decision not to continue with the pilot. Interestingly, though, the exemption was varied quite significantly in May 2024. And in fact, drug use in public went back to the former criminalization model. So public drug use has not been lawful in the province for almost 2 years now. So any street disorder that people are seeing or believing that they're seeing in the last year and a half, 20 months, even if it was related to substance use earlier than that, but certainly in the last almost 2 years, it has been illegal to use drugs in public. So this won't make any change to that. And I think, one of the huge challenges we have in our province is we have a housing crisis, and there are thousands of people, and that is not an exaggeration. There are literally thousands of people, according to counts, living unhoused. When you live unhoused, everything you do happens in public, and during the day, people just move from place to place to place to place. I think that contributes to the public sense of being unsafe. Well, interestingly, at the same time, crime rates have gone down. So, perception versus reality is something that we really have to struggle with, and that's where, to my mind, evidence is so critically important, because anecdote, it tends to get our attention, but anecdotes won't solve any crisis. It's evidence of what works that we really need to look at.
Anecdotes can also be people's own experiences, and from what people see, certainly there is more evidence of that public disorder. Businesses as well reporting that. Let's just hear from the mayor of Nanaimo, Leonard Krogan, what he had to say.
I said over and over again, even to parents who are deeply addicted didn't want to walk down the streets of their community with their 7-year-old child and have them see someone else engaging in open drug use. It was not going to work on a political level. And from a health perspective, it appears we don't have the statistics to suggest it's worked on a health level either.
So on that perception, is that not enough to warrant some kind of change in public policy?
So Let me just address what Mayor Krogh said, that people walking down the street don't want to see somebody using drugs. A couple of things there. So as I said, in May 2024, since May 2024, it has been illegal to use drugs in public. So this walk back from the decriminalization pilot isn't going to change that. It has been illegal. In terms of public safety, yes, nobody, and rightly so, wants to see the vulnerable people in our communities who are living unhoused. It is an awful thing to witness. Sadly, what often seems to be happening is that we are blaming the victims, those who are living unhoused, whether it's due to pure economics, whether it's due to underlying mental health challenges, whether it's physical health challenges. And, what we should be looking for is housing and places for people to go during the day. Shifting people from place to place to place doesn't help anybody.
My guest is Lisa Lapointe, BC's former chief coroner, has served for 13 years, 2011 to 2024, when she retired. And we're taking calls from our audience as well, asking you, how do you feel about the end of decriminalization in BC? What should happen now, and how can BC help people who are struggling with addiction? Our number again, 604-669-3733, 1-800-825-5950. Craig is joining us from Chilliwack. Hi, Craig. How are you feeling about this decision by the province?
Hi, thanks for taking my call. We always hear about addiction and trying to get people off drugs and into detox, but I don't hear much about what happens after detox. I mean, you release the people, and they get back into the same lifestyle, through their friends or whatever, and it becomes cyclical. So I'm wondering if there's, I know the government has a trades program. I'm wondering if this can be linked, after detox, can be linked to education and trade services to make positive change in people's lives.
Craig, thank you so much. Yeah, thank you very much. Good to hear from you in Chilliwack. Yes, Lisa, what about those other measures? The criticism was there was too much focus on decriminalization, not enough on those wraparound services, on not just detox, but longer-term treatment.
Absolutely, Michelle, and the caller makes a really great point. So, decriminalization in and of itself was never going to solve the toxic drug crisis. It is part of a suite of services. Decriminalization was intended to provide people with the comfort to come forward, to admit their substance use, to seek help and supports. People waiting for detox, or after detox waiting for treatment, there is a long line. So we know that despite the province, I believe they said they funded 3,700 beds so far, but there are 100,000 people with a substance use disorder in BC, and more than 100,000 more than that who use drugs. So treatment, yes. But it needs to be evidence-based. And as an aside, I should note that our province still does not have any standards for residential drug treatment, nor are there any regulations that require reporting of outcomes for that kind of treatment, which is a huge gap, because if we're going to solve this crisis, we need to know what's effective. But the caller is absolutely right. People leave treatment. I think there is a real misunderstanding that people are fixed. Somehow they've gone through a session of treatment. Oftentimes the goal is abstinence, but this is a relapsing condition. People often relapse, and they absolutely do need ongoing support. It is a very complex medical condition. People need supports, they need housing, they need training to get back into the job market. They may need mental health supports, counseling. I know many families who are paying for that out of their own pocket because it just doesn't exist in terms of public funding in the province. And then one other thing I should note, I think people tend to see those who use substances as those who we see visibly on our street, our most vulnerable community members. And in fact, they are the minority of people who use drugs in the province. The vast majority of people who use drugs in the province and who die from drug toxicity live in the suburbs, they live in the urban areas, they live in rural neighborhoods. So what we see is a very small number of the entirety, and I think it's really challenging when people draw assumptions, when policies are created on the basis of a very small group of people, when the impacts, in fact, affect a much larger population.
I also don't want to lose track of Craig's point, which was also included education, so that education piece as well. Thank you very much for the call, Craig. And our numbers again, 604-669-3733, 604-669-3733, 1-800-825-5950. And so why don't I follow up with you on that, Lisa? Where were those other elements then during this whole pilot program?
Yeah, I thought it was kind of interesting yesterday when the minister announced that they weren't going to continue with the pilot and they were launching or making much larger this Access Central, which is a phone line.
Yes.
One of the challenges in this crisis is that we really haven't seen any very great data from the province in terms of these innovations. So as I understood it yesterday, Access Central has been already operating in either Coastal Health or Island Health. I think maybe it was Coastal Health. It's always really interesting to see the data from these initiatives. The beds, for example, we don't know how many people have utilized the beds in the province. We don't know the outcomes for those people. So it's not just the decriminalization project. It is about treatment. Absolutely. It's about medication supports. It's about healthcare supports. It's about mental health supports. This is a really complex crisis. The police have told us time and time again, we can't arrest our way out of this. So it was interesting to me that the minister emphasized over and over that this is a health crisis and it needs a health response, while at the same time saying, well, we're going to go back to criminalizing drug use.
Rhonda is calling us now from Prince George as we ask you, how do you feel about the end of decriminalization in BC? Hi, Rhonda. Welcome to the call. Pardon me, it's Rhoda?
Yes.
Rhoda, thank you.
My comment is that there are people who are homeless, drug users that are self-medicating, and they lack the judgment and they have cognitive deficits to help themselves, and they experience barriers like because they have dyslexia or something and poor memory, so they're labeled with being non-compliant with their healthcare team. And then with my relative, he finally did choose to go to Burnaby Centre for Mental Health and Addictions, and they allowed him to go to the corner store to get junk food because his dad was giving him money, and there he'd phone the drug dealer because a sample is only $5. So there's not enough protection of these people or assessment of the homeless to see if they have cognitive deficits. The other comment I have is that a friend of mine knew she had drug use problems and her life was going downhill, but she couldn't figure out how to go to rehab and keep her apartment. So what do you do then? Do you wait? Because now she is on the street. Do you not help them to keep their housing while they're in rehab? So that's a barrier.
You talk about, yes, the barriers there, Rhoda, and also the multiple diagnoses, right? That compound issues for people as well, and the gaps there, it sounds like. When it comes to preventing, helping people who are seeking help, as your family member did, going to the Burnaby Centre for Mental Health and Addictions. Thank you very much for the call. Let's go to Rob now in Chilliwack. Hi, Rob. Your thoughts on the end of decriminalization?
Good afternoon. I'm very happy it's ended. I'm not a supporter of decrim, and I'm not a supporter of safe injection sites. And that's not to say I don't care for these people or I don't feel sympathy for them, Michelle. But look, decriminalization was destined to fail from day one. The NDP were supposed to have treatment facilities in place, which they did not. Okay. Number two, public perception. As soon as people saw, citizens saw open drug use in parks, in schoolyards, they were not on side with this. All right. My answer, Michelle, and I said it the other day on your show last week, I said, the answer is for David Eby to follow through, and your guest probably won't agree with me, but I believe in involuntary care, whether you're mentally ill or drug addicted, to save these souls on the earth. I mean, they need help. This didn't work. And I got to be honest, I was astounded by Josie Osborne yesterday, Minister Osborne's comment on a radio show. And she said what they're going to do is they're going to take this 3 years of data and they're going to synthesize it and analyze it. And I mean, I feel so much better now. This is what it took, 3 years of people dying and citizens feeling unsafe in their own neighborhoods walking down the street. It's actually appalling to me. But I really believe, Michelle, it's time to chart this new path, a new course, and introduce involuntary care in the BC legislature. Take these poor souls off the streets, help them whether they're mentally ill or drug addicted, and get the treatment facilities going and help these people. That's what I feel, Michelle. Thank you for taking my call.
Rob, thank you for the call from Chilliwack. Taking your calls, asking you how you feel about the end of decriminalization in BC. The health minister yesterday announcing they will not seek an extension to the 3-year pilot project as it ends at the end of this month. 604-669-3733 is our number. For our TV audience, we will be pausing for an ad break right now. We'll see you back here in 2 minutes from now. Right now, let's take another call from Val in New Westminster. Val, how do you feel about the end of decriminalization?
Oh, I'm really disappointed that they shut down the program. I think it takes time for these ways of stopping the use of illegal drugs. I think that our government has done everything they can do. They've thrown money at the downtown east side. They've tried kind ways. They've tried all ways to solve this problem. I hope that the government and the opposition are sitting down together, because I don't see the opposition coming forward with ways of kindly helping these people that are in such distress. I don't know if that exists, but I hope it does. I think they don't have any more ideas than the current government does. I also believe that over the years there's been millions of dollars put down in the downtown east side to try to resolve these situations. We're dealing with people with mental health addiction. It's a very, very complex situation. I think we have to continue throwing everything we can down the downtown east side to try to resolve. I don't believe these people that are saying that people are using drugs in schoolyards. I live in a little city. I never, ever have seen anybody shooting up in a children's playground. I think people take this issue to the extreme to try to put down the government rather than trying to get behind the situation and try to resolve it. If it is resolvable, and I don't know that either, I don't think anybody does. These people have nowhere to go. Housing is critical. They need to be properly housed and properly fed and cared for in compassionate ways. Just leaving people on the street is going to continue to result in them using their drugs in public. They have nowhere to go.
Val, thank you very much for the call. That's Val who called us from New Westminster. Let me wrap up here with Lisa Lapointe. Where do you see this going now?
I think, unfortunately, there is a lot of misinformation out there. I think people don't understand. As I said, for the last 2 years, public drug use has been unlawful. And in fact, if you look at who was using drugs publicly, as your last caller said, it was people who were living unhoused, frankly, didn't have anywhere else to go. That is the minority of people who use drugs in our province. Most people who use drugs in our province live in neighborhoods like yours and mine, and in other areas of the province. The highest rate of death is in the Northern Health Authority. The challenge is that there is not a simple answer. And, I hear Mayor Krogh and one of the other callers saying, well, involuntary care. Well, involuntary care, the evidence does not support it as a meaningful measure. People like the sound of it. It sounds simple. Treatment in and of itself is not simple. Many people relapse multiple times, and involuntary care has not been shown to be something that in the long term will make a difference. It's a multiplicity of things. So prevention efforts, and we don't really have a prevention strategy in our province. Education for students, including elementary school students and high school students. That is not a component of the high school or elementary school system right now. Access to healthcare, access to mental health supports, safe and secure housing, and treatment when people are looking for it. And it is, I understand government has funded many more beds, but I can tell you, ask any of those publicly funded providers, and they will tell you there are long waits at every door, and people are dying waiting for treatment. And then, we don't have time to talk about it today, but certainly providing people with access to a pharmaceutical alternative. It is the toxicity of the illicit street supply that is killing people. And until we can separate people from that street supply, which is not only killing them, but is causing brain injuries, physical injuries over the long term, real challenges, as one of your callers pointed out, in making health-centered decisions. Until we can separate people from that drug supply, we're not going to be able to have a meaningful difference. There are 225,000 people at risk in our province, and even if treatment is successful for everybody who can access bed, there's 3,700 of them. It would be years, and in the meantime, drug traffickers are just it's a pyramid, and they're just grabbing more and more users.
Another conversation to be had for sure. I will have to leave it there for now. Lisa, thank you so much for your time today.
Thanks, Michelle. Take care.
You too. Lisa Lapointe is BC's former chief coroner. It is 12:33 now. We'll pause our conversation on the end of decriminalization in BC, asking you how you feel about it and how the province can help people struggling with addiction. 604-669-3733 again is our number. You're with BC Today. I'm Michelle Elliott. Thanks for joining us. Right now, it is time for a CBC News update. And here's Rob Zimmerman.
Good afternoon. BC's Forest Ministry has reached a memorandum of understanding with China to cooperate on the use of wood construction in the country. The MOU, jointly signed by the federal and provincial governments, as well as China's Housing and Development Ministry, says they will work on the integration of modern wood construction for green building projects. The announcement comes as Prime Minister Mark Carney is visiting China, the first Canadian Prime Minister to do so in more than 8 years. Premier David Eby says BC's mining sector will be the big winner as a result of his trade mission to India. Speaking from Mumbai this morning, Eby says there's also demand for BC's natural gas as India's economy continues to grow rapidly. And Prince George RCMP say a 17-year-old has been charged with manslaughter in the overdose death of a teenage girl more than a year ago. They say officers responded to a home in the city in June 2024 and found an unconscious 16-year-old who later died in hospital. The Mounties say she was found to have high levels of fentanyl in her blood. And now the forecast on the north coast. Sunny this afternoon with a high of 6. Highs reaching 2 and mainly sunny in the Peace. In the central interior, a mix of sun and cloud with a high of 2 as well. Highs from 4 to 7 with some sun and cloud this afternoon in the Kootenays. In the southern interior, a high of 7 with a mix of sun and cloud. And for Metro Vancouver, Greater Victoria, and the Fraser Valley, lots of sunshine this afternoon with highs around 10. That's your CBC News update from Vancouver.
Thank you, Rob. Rob Zimmerman in the CBC Vancouver newsroom. We have lots of emails coming in as we ask you, how do you feel about the end of decriminalization in BC? The province not seeking to extend the program. It was a 3-year pilot program slated to end January 31st. And the province says it did not bring the results that they'd been looking for. And we have an email here from Elaine who writes, for people after they receive treatment at a licensed treatment center, there are also supportive recovery registered beds where they can receive ongoing supports in the form of education, counseling, one-on-one group and life skills. Then after a few months, they can go to sober living. Many folks navigating these services at times of crisis lack the navigational support needed to assist them in their journey. Colin writes, drugs have been around for a century. I've heard about it in my 60 years consistently, and yet we still have a problem. It's all about the money. Some people will always do drugs as they want to. Things will never change. Free, clean drugs eliminates all the negatives, as society will never be perfect. Joanne writes, the program failed because the province did not meet their own commitment of what they described as pillars of support. It's hypocritical of the minister to claim they were not able to meet infamous goals when they know they did not meet their own plans. Thank you very much for your emails. bctoday@cbc.ca is where you can reach us again. bctoday@cbc.ca, asking you how you feel about the end of decriminalization in BC. The province announcing yesterday it will not extend its drug decriminalization pilot project that ends at the end of the month. We continue to take your calls. How do you feel about the end of decriminalization in BC and what should happen now? 604-669-3733, 1-800-825-5950. Patrick is calling us from Penticton. Hi, Patrick.
Hello there.
Hi. And what are your thoughts about the end of decriminalization?
Well, I just wanted to make a comment about another caller that I had just heard in response to not seeing drug use on school fields. That in my community, that's categorically false. I work for a school district in the Okanagan, and I myself have picked up needles in fields. Actually, it's become a part of a shift in years past where you patrol the field with a bucket, picking up needles. I have friends who are teachers who have shown up to work to people overdose in the field. I mean, it's just out of touch and categorically false to say that people aren't using drugs in school fields and playgrounds. It's a huge issue, and it has been. And this is a good step towards ending that. And these people need help and treatment, and they need some discipline and structure, and not, you make it easier on people to do drugs, they're going to do drugs. You make it harder on people to do drugs, they're going to do less drugs. And there's no such thing as a safe supply. We're talking about heroin and meth. Thank you.
Patrick, thank you for the call from Penticton. Again, our number is 604-669-3733. Another voice now on this. Julian Summers is the founding director of the Center for Applied Research in Mental Health and Addiction, a clinical psychologist at Simon Fraser University. I spoke with him earlier today, and I asked him for his reaction to the province's decision to end decriminalization, and he said he wasn't surprised.
Yeah, the things that when we're facing a crisis of this magnitude, really in any health or social domain, the only two ways that we can really get ourselves out of that state are by preventing people who are at risk from entering into crisis and helping those who are already in crises to escape and reestablish wellness as quickly as possible. The decriminalization pilot seemed to be predicated on the idea that if we somehow lower stigma, that all of the services that we have in place in the province are adequate to rapidly help people escape crisis. And there was no basis ever to believe that. We do not have a system that is at all effective at rescuing people who struggle with addictions, homelessness, unemployment, and untreated mental illness. Those conditions are modifiable, and there are interventions around the world and even here in BC that have been shown to be effective. We chose to ignore those and didn't scale them up in the slightest. In fact, in many cases, they've been allowed to atrophy.
Was there a sense of urgency, though, at the time? We saw the numbers rising, number of deaths from the toxic drug crisis, and the thought was that people were dying as they were using drugs alone indoors. And this was a way to at least remove perhaps, that stigma. And so people would not be forced to use alone indoors and be able to access help should they need it.
Well, that would be a promising approach if indeed there were resources available that assisted people. But as I said, we were always lacking in that regard, and we didn't take any steps to bolster our capacity to assist people in the ways that are achievable. People who are struggling with addictions, homelessness, repeated involvements with courts and corrections, repeated involvement to hospital are capable of completely changing their lives and establishing dramatically different profiles of wellness and experiences of life. And that's been proven. So really all we did was somehow make drug possession and drug use less punishable. But the truth is that we were at the beginning, we were not taking a particularly punitive approach to substance use. When we examined the experiences of about 15,000 people who'd been diagnosed with addictions and who'd been repeatedly involved with courts and corrections, the contribution made by drug possession was about 3% of their total offenses and almost always added to other crimes. The most common form of crime was theft. And, of course, there was no discussion of decriminalizing theft, but it underscores that we've always had a much more severe problem than one that would be remedied by tinkering with the law or adjusting the supply of pharmaceuticals.
So what now then? What does the province need to look at now?
Well, there are programs and interventions that have been proven effective in the past, drug treatment court, community court, as well as voluntary programs that offer people rapid, like immediate, from that moment, opportunities to engage in receiving support and moving into healthy housing. One of the problems we face in BC, though, given these last many years, is that in addition to atrophying those few programs that had promise and had been shown to be effective, we've gone from a position of financial surplus to a quite severe debt. And that, I believe, means that the ability to advocate for growing effective programs is now going to be put under a much more stringent financial microscope. It needs to be. And from my perspective, that means that we need to reestablish evidence and the use of evidence in order to understand what's happened in these recent years, and so that we can make a very, very clear and soundly supported case to be allocating funds to initiatives that have been shown to be effective, and to satisfy ourselves that indeed people who we've been losing to this crisis in the last 5 years or so, when we've had no data, were in fact falling victim to things like transitions from hospital to the street and inadequate follow-through, or people who were using shelters and lacked a sufficient quantum of support. We need to be able to basically conduct an autopsy of the entire recent era of policy, and that's doable. We had data across ministries before, and we had it actually for 20 years. The current government made the decision to eliminate that monitoring when they introduced decrim and safe supply. So let's reactivate those data systems. This is an inexpensive task that I'm referring to, but so that we are clear-eyed in where we're advocating to spend money now that we are in such a marked deficit and debt.
If you had a choice, if notwithstanding budget constraints, financial constraints, what are the measures that evidence has shown will work?
So there are two, and it'll be stunning, I think, for any listener to reflect on the fact that we have neither a prevention strategy nor a rapid recovery strategy 10 years into a public health emergency. But both are highly effective and both are necessary. So on prevention, we know that drugs have become the leading cause of death among youth in BC, and the majority of those kids, as many as 75%, were clients of MCFD, which administers foster care. So we need to target resources on youth who we know are at risk of becoming isolated, victimized, despondent, and lose their lives to drugs. So there's prevention. The other is intervention among people in crisis. People are revealed as being in crisis all too often through the criminal justice system. There are interventions. Drug Treatment Court and Community Court, both active in BC as well as other places, have been shown to cut crime markedly and promote re-entry into society among people who choose that path. So there would be correctional approaches, but also the same opportunities for support, housing in healthy settings have been proven to reduce crime by over 70% compared to usual care in BC, and reduce medical emergencies by over 40% in the first year. And people choose them when they're offered. So voluntary as well as court-related programs that rapidly promote re-entry into society, we need to shift funding away from low-barrier types of settings and grow our portfolio of housing that's dispersed around the province, not concentrate on areas like the downtown east side or other settings like that, when we know, or we should know, that most of the people who appear in crisis in the downtown east side began having severe hardships outside of the entire metro region. It's over 80% began having hardships, and this is from back when we used to have good, hard data monitoring the beginnings and endings of people's involvements with severe addictions. So a provincial strategy that aims at intervening as soon as possible, either through voluntary programs or through court-related programs, and has the focus of aiding people to re-enter society and reestablish wellness through that process. It's doable. In fact, so far, very little else has been shown to be worthwhile in addressing a crisis of this magnitude in any jurisdiction that you look at.
That's Julian Summers, clinical psychologist, a professor at Simon Fraser University. David is calling us from White Rock. How do you feel about the end of decriminalization just announced by the province, David?
Hello.
Hi, thanks for calling in.
Thank you for doing this, CBC. You are an excellent fabric right across Canada and hopefully the world. I've got very little to say, but agree with virtually everything that was stated before, and that 10% of all of the people on the world, if you look at a maximum of 10%, will need all of their lives the help of the other 90%. And if we budget for that and look after them from birth, then you will reap the profits of all of that. And it's much cheaper than having it all shattered as it is now. The provincial government, federal government, neither one of them really wanted this to work because of the right wing. The idea that, well, we can't do that. But it's an inequitable distribution of the resources at present. If you gave that 10% what they needed with well-trained people from the start, from birth till they become productive citizens, we would truly reap a great profit. And thank you again, CBC, and for those who have spoken for being involved with this. Thank you very much.
Thank you, Randy. David in White Rock. Let's go to Randy in Vancouver quickly here before we go to our next guest. Hi, Randy. Thanks so much for the call.
Hi, Michelle. Thanks for taking my call. I couldn't agree more with a lot of what Julian Summers had to say. I think I agree that the past model of decrim, cancel it, stop it, it was ill-conceived. It wasn't supported by any research or data. It was basically a knee-jerk, almost harm reduction measure. I support, and many people support, harm reduction as long as there is treatment and as long as there is a solid prevention strategy, especially for youth. And I also support many people, I would guess the majority, involuntary mandatory care. I would challenge your previous guest, Lisa Lapointe, retired coroner for the province of BC, to tell me how involuntary care would not help a young guy I saw this morning while I was driving through downtown Vancouver. He was literally in a catatonic state, carrying a smoking, probably fentanyl pipe in one hand, one shoe on. His other foot was just one big abscess. He was drooling. He was not clothed and just stumbling through green lights. Now, if anyone can phone in and tell me how harm reduction could help that individual or save his life, I'm all ears. But my guess is involuntary care, apprehension, help the poor guy out, give him housing, give him 3 meals a day, get him healthy, give him treatment. And this rests right at the feet of David Eby. And I'll pull out David Eby and say he has a history of knowledge of knowing what to do. It's time that he actually does it. And one final comment. I took care of my late mother for 30 years. She had challenges with severe mental illness. She was admitted involuntary care into BC Women's Hospital. When she came out after 2 months, she was very compliant with her meds. They helped her get back on track in life, and she lived a very healthy, relatively healthy, productive life after that. There's a success story.
Okay.
And I just think people need to wake up with this and all these half measures and ideological bents to say, oh, harm reduction, drugs for all. That will not work. So there it is.
Randy, thank you very much for your call as well. Thanks for sharing your story about your mother as well. That's Randy in Vancouver. Joining me now to talk about what happens now and how police will handle this change in policy is Victoria Police Chief Fiona Wilson. Chief Wilson, thank you so much for your time this afternoon. I really appreciate it.
Good afternoon. Thank you for having me.
So the province is not going to continue with decriminalization of small amounts of illicit drugs. What will this mean for how your officers will approach people who are carrying 2.5 grams or less?
You know, the really significant changes that had a large impact on our officers actually happened in 2024 when the exemption was dramatically rolled back. And so the changes and the impact on our police officers now that the exemption is expiring isn't actually quite as significant as it was at that time.
And so what is that approach?
So back in 2024, initially there were 6 exceptions to the exemption and then 9. And in 2024, when it became really clear from communities across the province that the matter of public consumption was just causing a lot of upset and challenges in various communities, police in the province advocated strongly to have the exemption dramatically changed. And that's exactly what happened. So initially, there were 6 exceptions to the exemption, and that increased to 9. And then in 2024, it was changed again so that the only places that now the exemption applies to are in a private residence, in a tent when somebody's lawfully dwelling overnight, and in a health facility, many of which already have Section 56 exemptions. So the difference now is that, as was the case when the changes were made in 2024, our police officers, again, have the lawful authority to approach somebody in public spaces who are using illicit drugs and address that situation.
Now, even prior to the decriminalization pilot project, we had heard that in certain jurisdictions, police were already de facto using this, right? It was not a priority for them to apprehend or to seize these small amounts of drugs. How do you see that?
Yeah, and I would say in many areas there was de facto decriminalization, but part of that was as a result of Crown's despot policy that directed our members so that they understood that Crown would only actually approve charges for simple possession under Section 4.1 of the Controlled Drugs and Substances Act in really exceptional circumstances. And then actually during decriminalization, the Controlled Drugs and Substances Act had two areas that were added to it between sections 10.1 and 10.4. And those sections actually direct our members to consider all alternatives to requesting charges for simple possession under section 4.1. So my point is that, not only did we have de facto decriminalization, but a large reason why we had de facto decriminalization was because our members clearly understood that unless there were exceptional circumstances, Crown was unlikely to approve charges for simple possession.
And so is that status quo then? Will that continue? That kind of, I guess it's left up to the discretion of the officer.
What changed with decriminalization is that our police officers no longer had the lawful authority to arrest a person for simple possession when they might have been using fentanyl, for example, in a public space that was not an exception to the exemption, for example, at a bus shelter or at a beach. And, we even saw a number of those examples highlighted in the media after January 31st of 2023, when the Section 56 exemption took effect. And I think that was really shocking for people in community. And it was certainly something that police had flagged well before the exemption ever took effect. We were very concerned about the notion of public consumption because, of course, you decriminalize the possession and then you're also decriminalizing the use in some of those public spaces. So, that was a major concern for police. We philosophically agreed that we want to direct people who have a substance use disorder to pathways of health and not to the criminal justice system. And I think for the most part, we still feel that way. I certainly do. But we also had to be mindful of the impact that public use was having on broader communities.
Chief Wilson, appreciate your time. Thank you very much.
Thank you for having me. Have a great day.
You too. That is the Chief of the Victoria Police Department, Fiona Wilson. Much more coverage of this throughout the day here on CBC. You can go to our website, cbc.ca/BC.